Hey guys, welcome back to my channel. If you guys are new here, my name is Nkenna. I'm responsible for everything that goes on here. As you guys can tell from the title of today's video, we are going to be talking all about Surg Clinical. So just to give you guys a little bit of background information about me, I'm a second degree seeking student. I'm in a traditional BSN program. So what that means is I am in a 4-semester long program. I have fall, spring, which I just completed. We're off for summer, so I have 3 months off. Then I start again in the fall, I think August 19th. Finish in the spring, graduate May 9th, 2020. I'm excited. Just to go ahead and get right into today's video. My Surg Clinical lasted 12 to 13 weeks. It was a gray area. I say 12 to 13 weeks because there was some gray area at the beginning due to like immunization records and then communication with clinical adjuncts. Like the first week, I think our professor canceled it. So we had to go back and make up one of those clinical days. Within those 12 to 13 weeks, we did have 2 observation days. I ended up going to the OR for both of my observation days. Really, really cool. It further fueled my desire for graduate school and just what I want to do, what specialty I want to go into. Total for the semester, we had 135 hours for clinical. That was divided between campus clinical, simulation, and then on-site instruction. So to get into specifics of our clinical, they were 9-hour shifts every week. Not sure why, but 12-hour shifts, the longer the shift gets, the faster it flies by. Every week we had to do care plans and charting. We used DocuCare. It's basically the same as regular charting. You just go through and you can click through, you can type out notes, you can put in medications, everything. You can create a whole patient profile. When we arrived for clinical, we were able to help with vital signs. So one thing we always did before we went to lunch, we would get a fresh pair of vitals around 11 o'clock, which is the time that they would attain vitals anyway, and we would pass it off to the tech and then go about our business. I had the opportunity to observe for clinical in a level 1 trauma center on a neuro ICU step down floor. It was a pretty small unit, so there are around 3 nurses at all times, 2 to 3 nurses at all times on the floor, and sometimes we ended up getting floated to other floors in the hospital. I will say, getting to work on the neuro ICU step down, I did see a good bit of trach patients, which was really cool. One thing I really focused on with Surg was just really learning my medication. I will say that depending on what floor you work on, you're going to see more common medications specific to that floor. So for my externship, I work on a cardiac floor, so I'm used to seeing, patients come up and they're on amiodarone. But then I think across the board in the hospital, most people are going to have diabetes. A lot of people are going to have high blood pressure. So my main focus this semester was really just learning the drugs and being good at recognizing what is this drug used for, what disease process, what's going on here, and tying things on. Like when I would go through the chart, look at something and being say, they're on this because of this. They're on this because of this. This semester, I was able to accompany the nurse to go to take patients to procedures. So I was able to take patients to MRIs, to CTs. One patient had to go do the barium swallow test. Surg, we got to see a lot more collaborative team, interdisciplinary team effort. We got to communicate with physical therapy, occupational therapy, dietary nutrition, physician's assistants, nurse practitioners, and the attending physician. Also at this hospital, they did have residents. With my Surg experience, there were a lot of young nurses, so it was very relatable. Got to talk to them about stuff. My go-to icebreaker question was, how long have you been a nurse? Where did you go to nursing school? And then I just kind of opens the floor for discussion and asking them, what was your favorite class? Or, do you want to go to grad school? Things of that nature. Every week I did get to conduct a head-to-toe assessment, and I got to do this when my clinical adjunct would come in, or maybe he wasn't around, and I would come out and I would just give him a report on the patient. Like he was going to go in and take care of the patient, tell him, what was the chief complaint? What are they here for? What was abnormal? What were their abnormal labs? Why, what could be causing those abnormal labs, what medications they're on, and their last set of vital signs. We had 3 different campus clinical sessions for this course. One of them was on trach care, one of them was on end-of-life care, and then the final simulation, it was kind of just talking about inappropriate patient interactions and what to do when you're posed in those types of situations. Overall for Surg, I had a really good clinical adjunct. I really enjoyed it. It was pretty cool. I'm excited to take high acuity next semester because it's just going to build on what I've already learned in Surg, and high acuity at my school is essentially Surg 2. However, now you're in an ICU setting. So yeah, that's pretty much everything that I have to tell you guys about my Surg clinical experience. I really enjoyed it. I'm really glad that I got to observe in the OR. I had a really good clinical adjunct, and I just got to see a very diverse patient population. So yeah, I hope that you guys enjoyed this video. If you guys did, don't forget to give it a thumbs up, hit that subscribe button. If you guys have any questions, comments, or concerns, you guys can leave them down below, or you guys can find me on Instagram at a nurse named Ken. As always, thank you guys so much for watching, and I'll catch you guys later. Bye.